Overview: during an abdominal ultrasound, a provider uses sound waves and a computer to take pictures inside your belly. What is an abdominal ultrasound? An abdominal ultrasound is a type of imaging test. It uses high-frequency sound waves to create pictures of the organs and blood vessels in your belly, abdomen. You might hear healthcare providers use the term sonogram. Generally, ultrasound refers to the test, and sonogram refers to the image the test produces. Why would a doctor order an abdominal ultrasound? There are several reasons why a healthcare provider may recommend an abdominal ultrasound. One of the most common is to check on a developing fetus throughout pregnancy. Providers often call this test a prenatal ultrasound. Ultrasound can also check parts of your digestive system, including your liver, pancreas, gallbladder. A complete abdominal ultrasound examines those three organs, as well as your abdominal blood vessels like your aorta and inferior vena cava, spleen, kidneys, bladder. What can an abdominal ultrasound detect? Abdominal ultrasound may also help pinpoint the cause of unexplained abdomen, stomach pain. It can help diagnose conditions, as well, like abdominal aortic aneurysm, enlargement of your abdominal aorta, kidney stones, kidney cancer, bladder stones, gallstones, cholecystitis, gallbladder inflammation, liver disease, kidney disease, pancreatitis, enlarged spleen, abdominal cysts or tumors, fatty liver disease, certain types of cancer, like pancreatic cancer. Test details. How does an abdominal ultrasound work? Ultrasound uses sound waves you can't hear to take pictures of soft tissues inside your body. To capture these images, a provider glides a handheld wand, transducer, over your abdomen. The ultrasound machine sends out high-frequency sound waves that bounce off structures like organs, blood vessels, and other soft tissues. A computer receives these signals and uses them to create pictures. Abdominal ultrasound preparation. Your healthcare provider will give you complete instructions before your ultrasound. Follow their guidelines to ensure the most accurate test results. Your provider may ask you to stop eating or drinking some hours before your test. In some cases, you may need to drink a specific amount of water right before your test. Or you may not need to prepare at all. Abdominal ultrasound fasting. Depending on your situation, you might need to fast before your abdominal ultrasound. Having a full or empty bladder or stomach can sometimes lead to blurry images. Ask your provider if you should fast before your appointment. What to expect during the test. For an abdominal ultrasound, you'll lie on your back on a comfortable table. You'll need to pull up or remove your shirt or put on a hospital gown. During the test, a healthcare provider applies gel to your abdomen. This gel may feel cold, but it won't hurt you or damage your clothes. Moves the probe over your skin. Your provider gently moves the handheld ultrasound wand over your skin, on top of the gel. They'll move the wand back and forth until they clearly see the areas in question. Gives you instructions. The provider performing this test may ask you to turn to one side or hold your breath for a few seconds. Cleans your skin. They'll wipe off any remaining gel on your skin. If your provider wants to study your blood vessels, your test may include Doppler ultrasound. Doppler sound waves detect details of how blood flows inside your blood vessels. How long do abdominal ultrasounds take? On average, an abdominal ultrasound usually takes 30 minutes to complete. But it could take more or less time depending on your situation. Are ultrasounds safe? Yes, ultrasound is a safe and accurate imaging test. Unlike X-ray imaging, ultrasound doesn't use radiation, which can cause health issues at high doses. Ultrasound has no known side effects. Imaging care. Results and follow-up. When should I know the results? After your test, a radiologist, doctor who specializes in reading medical images, will review your ultrasound pictures. Then they'll write a report of their findings and send it to your primary care physician, PCP. In most cases, this takes about 1 week or less. Providers sometimes use ultrasound to diagnose potentially life-threatening conditions in an emergency. If your provider suspects an urgent concern, you'll get results right away. What should I ask my healthcare provider? If you need an abdominal ultrasound, here are some questions you may want to ask your provider. What type of ultrasound do I need? Will I need any other tests? How do I need to prepare for my abdominal ultrasound? When can I expect to get my results? Additional common questions. Can you drink water before an ultrasound of the abdomen? It depends. Drinking small amounts of water with daily medication is usually okay. But your provider might need you to fast for 8 hours before your exam. If you're not sure, ask your healthcare provider what you need to do in the hours leading up to your appointment. If you need an abdominal ultrasound, it's normal to wonder what to expect the day of your test. Ultrasound imaging is safe and non-invasive. In most cases, it only takes about 30 minutes. Your healthcare provider can talk to you about why you need an ultrasound and what you can expect once you get your results. When you need a clear picture of what's happening inside your body, the imaging team is here for you. Imaging care.